And what is your name?
My name is John Hart.
And where did you hear about us?
Originally, had moved here about 10 years ago and had been in chiropractic elsewhere, so I started immediately looking and found you through Google and Facebook.
Okay. And where are you from?
Originally, I'm from the Maryland tri-state area. Have lived all over the country before moving down here.
And what kind of problems are you dealing with when you came here?
When I first came here, most of it was the spine, neck, shoulders, hips, just from your normal life, falling off the horse and all those fun things that go on baseball, football.
And how often were you having these problems?
Oh, it was some of the injuries that I had from many, many years ago were severe to where I needed to stay in a maintenance program. I learned the hard way. You'd stop doing something for a while because insurance wouldn't pay for it or whatever, and I was in a lot of pain, and then it takes a while to get straightened back out. So I have been doing chiropractic since 1990. Things have changed a whole lot since then. So I had at least the knowledge to look specifically for the type of chiropractic that Dr. Garner.
And now, how are these problems affecting your life with your friends and family?
They certainly affect you when it comes to your ability to do things that you want to do, not just your work, which is an obvious thing. If you work outside in the service industry like I do or did, and but when you're making family plans, I've got a little girl, and everything about that's wonderful, but I think, wow, if I'd had a little boy, I wouldn't be able to help coach baseball or football because I can't do that stuff. It just hurts too much. You do what you can, but then you're in too much pain, and at that point, it was a necessity to keep going.
Now, as the result of the care that you've been receiving here, what kind of changes have you noticed?
They're all positive. A year ago, a little over a year ago, I was run down by somebody playing on a cell phone with a pickup truck as a pedestrian. So I've had massive injuries. So what started as maintenance, it's a whole lot more maintenance now. I wouldn't be able to function at all if it wasn't for Dr. Garner and the staff here and the many different types of treatments that you offer. Surgeries didn't exactly work on some of the things, and I've opted to not have some other surgeries because I've learned over the years that needs to be the last resort. So what I will say is I wouldn't be able to function at all, and I'm not just saying that. I would not be functional. I have a brain injury, and that part is something that is beyond everybody, including neurology. But shoulders, hips, back, neck, spine. I was in so much pain I couldn't move. Now at least we know what's fixable, what's not, and Dr. Gardner and the staff here has kept me functioning as well as possible. Unfortunately, the brain part can't do anything about, but the rest of it, I can. Regular doctors and the neurologists are baffled because I should not be able to do the things that I'm able to do. I should be in a coma. I should be dead. I should be in a coma. I should be paralyzed. I should not be able to do. And I could do more if the head injury would allow, but physically can do things that they don't understand how I can do.
Now, what have other people noticed about you?
Friends and family, on good days, I can fool just about anybody. They don't realize that I still have many of the injuries that I do. So I can attest that straight to the treatments that I have here, because I can get around and because I can do these things, many of them think I'm okay or I'm better. You can use that term lightly. I'm better than I was, and as long as I continue with the different treatments, and Dr. Gardner is always coming up with new stuff. You know, I mean, new technologies that he checks out and looks at, and eventually he comes and says, you know, I think this might help you. You might want to try it. And the treatment in here with the shockwave therapy for my shoulder, they told me I was going to have surgery. It's not 100%, but I couldn't do any of that, and you know, I don't have much strength, but I can move it, so no surgery.
With that being said, what can you do now that you couldn't do before?
Oh gosh, I can go up and down stairs without. I have a service dog, but I can go up and down stairs without the use of the service dog most of the time. My brain sometimes doesn't want to allow me to do that, you know. So but as far as the physical part of it, I can do those kinds of things. I can get in and out of my pickup truck and drive it versus it has to be the van. I can walk the dog. Again, there's a lot of these depends on what my brain wants to allow me to do that day, because that's a whole different subject. But physically, I can do the majority of those things within whatever restraint my head injury wants to allow. But as far, I mean, there is some limit of movement. This is as far as it goes. But considering I couldn't bend my elbow because, you know, I couldn't feel my fingers, I couldn't, you know, you can see that I've got some stuttering and shaking. That was through my entire body. So that was a combination of the spine being way out of whack.
Mm-hmm.
I think he said 24 out of 26 vertebrae or something. It was bad. And I can do these things without excruciating pain. You know, and I did. I had excruciating pain. It was terrifying, quite frankly.
And what else in your life has changed?
It's definitely made it to where I can continue. My daughter dances 6 days a week, and although the accident and injuries are terrifying to them because they saw it, they're also able to sit back and realize that if I can keep going, they got no excuses to whine about things. You know, that's one of the things that you don't realize that chiropractic can give you in all the different types of treatments that are offered here. It can not just affect you, but it can affect your family. If they can see that you can get the mobility back, it changes people's perception. It gives you a second chance of enjoying. For me, it's my daughter, but for many, it can be their grandkids or whatever, and being able to be around and still participate in the things that they thought they wouldn't be able to participate anymore. Not going under the knife is a really nice option, because that's irreversible and it might not work. and to me, that's a very last resort, because I don't want to have the oops excuse by doctors that say they thought it might work. Well, I got news for you. They told me only surgery was going to work for the shoulder. Nope, this worked just fine. Again, the only inhibiting things I have are because of the brain injury. But everything else Dr. Garner has been able to make 1,000 times better than what it was. And honestly, you know, he made it, and the staff here made it to where I could function with my job before, what I did for a living, running my business. It kept me functional and mobile and able to do all the things, you know, alleviated pain, and now it's made it to where I'm not in a walker or a wheelchair. I'm able to continue to do things again. Doctors and neurologists, one, they don't understand. They, you know, you shouldn't be able to do this when you can't do that, or you should, you know. My response is, well, sorry, I'm gonna get hit by the truck again. I don't know, but the treatments here have allowed me to continue to keep going, and I'm not what I used to be, but I certainly can do a whole lot that people don't expect me to be able to do. Can't do it as well as I used to be able to do, but it's a whole lot less painful. Most of the pain I have is from the neuro injuries, not physical injuries anymore. He's alleviated most of that, and it seems like at this point, it's been a year and a half almost. At this point, as long as I come in every 3 weeks, things just kind of, more than that, I get out of whack.
Now, is there anything else that you would like to say?
I would like to tell people to stop. If you're the old style of chiropractic, and the words that every chiropractor hates is, oh, he cracks. Yeah, Dr. Garner can still manipulate the spine that way. It does work. I did it for years and years and years. The newer equipment and the newer advancements allow him to be able to make adjustments without that. So there's no more of the, you weren't sure what was going to happen. I used to hate it when I had the doctor that I would see went on vacation and you had a substitute kind of thing. And they did things slightly different, and you would all of a sudden tense up at the wrong time, and your spine was adjusted, but now you got a pulled muscle. That's realistic. It happened. But with the newer advancements, none of that happens. With the Pro 360 and these things, yeah, Pro Adjuster, none of that happens because he's not physically manipulating. So there isn't that fear that you hardly even realize he's doing it, and it's really some things in technology you wonder about. This is really good technology. So I walk out of here with no pain, and things adjusted correctly. So I guess what I'd like to say is don't listen to that hype and to that, that's old news. And yes, many of them, including Dr. Garner, can still do things that way if necessary. Sometimes he does need to get down and work with my knee or whatnot. But the technology has made it to where a lot of that stuff doesn't happen anymore because it's not necessary for him to make the adjustments that way. So what I would say is that don't make surgeries and those kind of things the last result if nothing else works, because they're irreversible. You can't go back. I've survived cancer twice also. There's no putting body parts back after they've removed them. Now other things don't work like they're used to. This is the same thing. Once they start cutting and removing and there ain't any going back, that's permanent. So look at other alternatives. And chiropractic doesn't only, it's amazing, doctor. This time of year, I'm usually sneezing and carrying on He takes care of my sinuses over there with the same machine. I don't have to take allergy medicine every darn day. Used to. So there's a whole lot of other things that people don't realize, because your whole body's connected and all of it runs through the nervous system, and it's